I would check my order. I would knock. I would identify my patient. I would tell them who I am. I would tell them the procedure that's going to be happening. I would make sure that they are in general appearance is good, that they are alert and oriented ×4. I would make sure that they aren't childlike or behaving in any way that, you know, isn't appropriate for the situation. I would make sure that they are dressed appropriately, that they communicate well. I would make sure that everything that I could was good before I started doing anything. Then I would wash my hands. Once I washed my hands, I would make sure that privacy was provided. If privacy wasn't provided at this point, I would provide privacy. I would raise the bed. I would raise all 4 side rails before I did that. Then I would lower the side rails closest to me so I could work. Once the side rails have been lowered, I would raise the bed to high Fowler's position. I would apply pull socks to the patient's finger and get the vital signs. Take the vital signs at this point. I would assess the gag reflexes. Make sure that that was in working order. Once everything was good, I would then make sure that the patient didn't need anything and she was okay and comfortable, and I would set up my bedside table. I would place the towels on my patient. I would assess the nares to make sure which one I was going to choose. There's no irritation, no redness, no polyps, nothing in the way that will be causing any problems. Once that was determined, I would measure my NG tube to the appropriate length. Once appropriate length has been established, I would tape it. Once my gloves are on, I would then lube my NG tube up 4 inches. I would give my patient the water. I would tell them if they felt any discomfort to raise a hand so that way we could stop the procedure. I'm going to lean their head back. I'm going to insert the NG tube. Okay, tilt forward, please. Swallow for me. Okay. Going to secure the tubing. I'm going to check for placement. Okay. I do have residual. We would measure it. If it wasn't enough, I would do it again. If my syringe was full, I would check and see how much residual content I had. Then we would slowly put it back. Once residual was back in, I would make sure that the tubing was secure. I would make sure the oxygen on my patient was good. I would make sure suction had been attached. I would make sure that the call light had been given to my patient and that the bed was to the lowest position. The side rails were lowered. I would administer my call light to my patient. I would make sure that they were in good body alignment, that they didn't need anything. Once everything was done, I would clean up my area. I would remove my gloves. I would wash my hands, and I would leave the room and document anything that might be abnormal or anything that, any complaints, and then just general documentation of the procedure.